The Centers for Disease Control and Prevention say 1 in 5 U.S. adults experience mental illness. In rural Minnesota, concerns are growing about future access to help.
Blue Cross and Blue Shield has pledged $600,000 to Minnesota State Mankato Center for Rural Behavioral Health. As J.J. Moore shows us, the center's mission is to improve rural mental health care.
At Minnesota State Mankato, this building is more than bricks and mortar. It is a rural mental health oasis.
So the idea for the center really originated from some research of mine that projected the mental health workforce out a decade.
Thad Schunkweiler, director of the Center for Rural Behavioral Health, says those workforce numbers were alarmingly low. He wanted to change that.
We are one of the first academic research centers in the country that is exploring how do we get more resources in these underserved communities.
We will be done at this time next year.
That's crazy.
Schunkweiler decided to pursue rural students who could return to meet mental health needs of rural communities.
Research is very clear. Students who come from rural areas tend to go back at a higher rate than folks, say, from more metro-based areas.
Schunkweiler says one of the top rural mental health concerns is suicide. And his center's research has found the rural suicide rate over the last 20 years has been greater than in the cities.
I think it's a lack of connection. I think in rural communities, we tend to find ourselves more isolated, both geographically but also emotionally. And I think that leads to people's worsening mental health. And so
Ultimately, Schunkweiler and the center hope to improve access and support through a more diversified workforce. Reporting for 360 Journalism and Blue Cross, I'm J.J. Moore.